What's up, everybody? I'm gonna give you guys some time to get into the room, but welcome to Tip Talk. Today, we're gonna talk about my breast cancer journey. Um, and while I wait for a few of you guys to come on into the room, let me just make a couple of announcements. All right. Um, November 8th and 9th, I'm going to be live in Bend, Oregon at Jazz at the Oxford. November 20th, I'll be live in Baltimore at On D Music. And November 22nd, 23rd, and 24th, I'll be live in Philly at South Jazz Kitchen. So if you want to see me at any of these places, I hope you're following me on Bands in Town. The ticket links for the shows that are available are already up. Okay, so I'm going to put the link in the chat if I can. And also, I've got just a few copies of this, under 35 of this in stock, the vinyl of Until We Meet Again. And of course, I have CDs for anybody still collecting CDs. You can get those at cyberspace.shop. Cyberspace.shop is the name of my online store. All right. Let's see. I'm going to try to see if I can see anybody in here on another screen. I thank you all for coming. So, what we're going to talk about tonight. Okay, I see we've got some people in the room. Perfect. Perfect. Welcome. Hello, Miles. Hello, Trina. Thank you so much. Thank you for joining us. What we're going to talk about today is breast cancer. So, as you all may know, less than 90 days ago, I underwent a mastectomy and reconstruction surgeries. It's 2 different surgeries in one day on July 31st to treat what had been diagnosed as stage 0 breast cancer, what became later stage 1A breast cancer. So I'm going to talk about all of that tonight and talk about what my journey was like, and from the time I was screened until now. Okay, just 3 months, at the 3-month mark of my recovery. I'm going to bring on a good friend of mine. She was voted in the top 10 best doctors of North Carolina. Dr. C. Nicole Swiner is also known as Doc Swiner out in these Instagram streets. She is a family physician, a 7-time best-selling author, speaker, wife, and mother in Durham, North Carolina. She's also affectionately known as the Superwoman Complex Expert and has written 2 best-selling books on the topic, which has now evolved into the hashtag No Superwoman Lifestyle brand. She attended Duke University and went to medical school at the Medical University of South Carolina. Doc Swiner has become one of the nation's experts on self-publishing, media in medicine, wellness, physician burnout, and work-life balance. And tonight she's going to balance out and bring some levity to this conversation from a medical perspective. Ladies and gentlemen, Doc Swiner. Welcome. I'm so good. How are you? You can't give a singer lyrics and expect her not to sing them all. Oh, I really appreciate you being here. So I'm going to quickly sort of lay out what happened to me, or what happened with me. Back in April, I got a message on my medical, healthcare app saying, hey, it's time for your regularly scheduled screening. Actually, I think I got the message in March from a doctor I'd never heard of, Dr. Khan, wherever you are. Thank you, Dr. Khan. So I think 2 weeks later, I went ahead and scheduled my mammogram, and that was April. I went in, got my mammogram, and the radiologist, God bless her heart, she had a human reaction. It was a very fleeting moment, but I saw it. And what I saw told me very deeply in my ancestral spirit that I had it. I was like, whatever you're not supposed to see, she saw it. And I remember going to the car and telling my husband, Sean, I think my exact words were, I got that shit. So um, he was like, "What do you mean?" And I told him about the reaction I saw, even though she was like, "Oh no, it's nothing. I just kind of have to." Da, 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 da. Long story short, I did get a phone call the next day, or maybe that day, saying, "Hey, we need you to come back in for another screening." And I was like, "Well, is everything okay?" And they were like, "Oh yeah, we just got to." Da, 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 da. Now, you tell me if this is true. I think the radiologist can't technically give you your diagnosis. It has to come from your doctor. Is that right? Mhm. 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 Right. Mhm. So that's exactly what happened. They sort of implied the urgency for me to come back in for a new screening. And so I went back in and had a second mammogram. The second mammogram I had was the type where I had to lay down on a bed and put my breast through this hole, and it was horizontal instead of standing. Most of the mammograms that I have had have been standing ones.
Mhm.
So this one was different. Um, and then after that, that put me into the end of April. I think I went straight into a doctor's office from that mammogram. They, instead of just letting me leave, they walked me into a doctor's office, and she
Yeah.
said, we need to schedule a biopsy for you. What we are seeing is something abnormal, so we need to schedule a biopsy. And I knew from there that it was really urgent. We weren't able to schedule my biopsy though for like another 4 weeks.
Mhm.
So the entire month of May, I was kind of traveling the world, kind of thinking, yeah, I think I have a full blown carcinoma, but I won't really know until I get back home and get this biopsy on May 29th.
Right.
I got the biopsy when I got back home from Europe. And on June 5th, I got the phone call from my PCP, my primary care physician, letting me know that I had DCIS stage 0, that's ductal carcinoma in situ at
Mhm.
stage 0, and would need to see a breast oncologist and take
Mhm.
it from there. So I think it was when I think it took 2 weeks for me to get in with the breast oncologist, or maybe like 10 days to get with her.
Mhm.
And it was at that point that she had me do another screening. There's a lot of screenings involved, but I had to get an MRI, and then I had to
Mhm.
get genetic testing, genetic blood work done. And
Right.
she did this other testing of my hormones. Maybe you can explain that.
Mhm.
I
Mhm.
know you're not an oncologist, but
Yeah.
I,
Yeah.
I think you have some general. I think you have some general knowledge of what that hormone thing was.
Yeah. So did you do tissue testing for the hormonal testing or blood work for your hormonal testing?
Blood work. It was blood work.
Okay. Yeah, because as you'll probably get into, there are different hormonal or receptor types to breast cancer that you want to identify, ahead of time so that you know what type of treatment is the most effective. So yeah, a lot of blood work. This is for any workup, for any abnormal
Hmm.
thing from a screening test for cancer. Lots of blood work, lots of labs, lots of testing and imaging. So God bless you. You were a soldier, but it's what it's what it takes for us to make the most accurate diagnosis possible.
Correct.
Hmm.
So thank you for explaining that.
Yeah.
Um, so after she determined all of that and got the information she needed from those next screenings, the MRI and the blood work, I went back in with her, and she told me the results of that. So basically, what she saw was the same thing that the mammogram saw. ductal carcinoma in situ at stage 0.
Yeah.
I tested negative for the hormone blah blah blah. I don't know why I can't remember what that is, girl. But I tested negative for that,
Receptors.
and receptors. Thank
Yeah.
you.
Yeah.
And I also tested. The genetic work showed that what I had wasn't any sort of genetic mutation or anything like that, and all of this was good news.
Yeah.
I think we also did some kind of lymph node testing thing too, and I tested negative for that. So this was all very good news.
Yeah.
From this point, she was able to let me know what my treatment options were. Um, and at the time, my options were a lumpectomy with radiation, a course of radiation treatment, which would be about 6 weeks of radiation, 5 days a week.
Mhm.
My other option was to have a mastectomy with reconstruction. A mastectomy is the complete removal of the breast, as opposed to a lumpectomy, which is just a removal of the lump associated with the carcinoma that they found. Is that
Right.
correct?
Yeah. Absolutely.
Okay, so the mastectomy with reconstruction would not have required any radiation. I knew immediately that's what I wanted to do. So that's what I chose. Um, and whew.
Mhm.
And the next steps after that were to meet with a new surgeon, a plastic surgeon, and then those two surgeons would have to have their schedules coordinated so that they could perform both surgeries on the same day.
Right.
Um, I got my
That's a
surgery
long
date.
day.
Yes,
Yeah. For
yeah.
you.
Uh,
Right.
yes. So I met with my plastic surgeon, and he had options for me too. So my options were to just get the mastectomy and leave it bare, and just have one breast, or get a mastectomy and reconstruct it um, with an implant or
Mhm.
with tissue from my own body. I
Mhm.
chose the tissue from my own body because I personally wasn't interested in anything that might require augmentation. I didn't want my breast to get bigger in any way, shape, or form. Um, so that surgery, he explained to me, it was called a flap,
Mhm.
reconstruction via flap. That is a little more uh, in what's the word? It is a little more rigorous
Yeah.
because when you're taking tissue from another part of your body and putting it in another place of your body, you have to connect that tissue to a blood vessel so that it gets oxygen and doesn't
Mhm.
die. Is that correct?
Yeah. You got it.
Okay. So because of that, what would be normally like an hour and a half surgery with an implant would become a 6 hour surgery with the type that I was getting.
Mm.
But the pros of that where you never have to fix it. Like it's
Right.
not going to burst on you. He said that 99% of patients who get reconstruction via flap do completely fine for the rest of their lives.
Yeah. Because it's your
So I
natural
like those.
tissue, right?
Yes,
Yeah.
correct.
Yeah.
So those odds were very attractive to me. That's what I chose to get.
Mhm.
So tell me, do you have any insight on you know screenings? And I know a lot of people who are just fearful of mammograms and MRIs, especially
Yeah.
because of the the contained nature of MRIs. Can
Right.
you give us any insight on why those are necessary and why we shouldn't be afraid?
Yeah. So you mentioned a lot of great things, and thank you, by the way, for being honest and transparent about your journey. So hopefully you can help a lot of folks listening in, and even more that hopefully watch this recording. But when it comes to screenings for almost any cancer issue, whether it's breast, colon, lung, etc., extremely important. Like I can't even, I can't even express how important it is, particularly for Black women, that we get those screenings on time and as often as we're supposed to, right? Because
Mm-hmm.
we suffer, unfortunately, from these conditions, just like almost any other medical condition, almost double the amount than, quote, the normal population. So I just want to, as a family doctor, I want to encourage everybody to make sure they're getting their checkups and make sure they're getting all their physicals and screenings on time. But particularly for breast cancer screening, it has become more and more complicated because the guidelines keep changing,
Mm,
insurance coverage keeps changing.
mhm,
And so people
mhm.
are often confused and conflicted about when should I start, what should I get, how often should I get them, and who's going to pay for it. So there's all these complicating factors that get in the way, unfortunately, and then access get in the way of us, doing the things that we're supposed to do for the standard of care. So that was my disclaimer. And as by the way,
Mhm,
again, anytime I do any of these, I always have to remind people that, I am a doctor, but I'm not your doctor. So please check in with your physician, your provider, if you have any questions or concerns. But we're certainly here to give you the greatest advice that we can based on our
mhm,
education. So all disclaimers out of the way. Now back to the question, screening wise. Long story short, when you turn 40, you should be getting your first, if you haven't started before because of family history, you should be getting your first mammogram, period.
mm,
Age 40. We wavered back and forth a little bit on the guidelines in terms of when to start. It used to be 50, then it should switch back to 40. Definitely
mhm,
at age 40. If you have a significant family history, particularly if those relatives are what we call immediate, meaning, you know, mother, sister right next to you, we want to make sure that you're potentially starting even sooner than age 40. But the
mm,
current guideline from the task force, particularly as of this year, April, state that every woman by age 40, every other year should be getting her screening mammogram. That's kind of the gold standard. But there are, of course, asterisks in terms of other
mhm.
things. If you have a lump that you're already worried about, please do not wait until age 40. Things can happen,
Right.
unfortunately, at a younger age. Or if you have a male relative, because men, unfortunately, also get breast cancer. If you have a male relative that has ever had breast cancer, no matter how closely related they are to you, if he's blood related in your
Mhm,
family, you probably want to start sooner
mhm,
than that. So, long story short, always have the conversation with your physician, your provider, anytime you go in for your checkups and your annual exam. Ask your family members about family history. Often in the Black families, we don't share that
mhm,
information very well. So please ask your mom, your aunties, your grandma about their
yeah.
history so that you can make those educated decisions. And then don't skip. I personally have always been doing them every year. I think I even started, even though I don't have a family history, thankfully, of breast cancer that I know of, I started even sooner
Mhm.
than 40. I think I started like 38,
Okay.
39, right? And did it every year. So just
Yeah.
be diligent about that.
I'm so glad that you brought that up. That you may need to start earlier. Breast cancer is very common in my family on
Mm,
my mother's side, and I think my father's mother also had breast cancer, so I have it on both sides of the family. Back in 2019, I had a lump that I was very concerned about. And so I went to my OBGYN, who is a Black woman. God bless her. She's the bomb. Dr. Masterson, shout out to her. And it was palpable. I could feel it.
mm,
How we're taught to do self screenings. So I could feel it. She said, "Yeah, I see it. I feel it. Let's check it out.
yeah.
I'm going to, I think she may have done an ultrasound, but she gave me a referral to a breast specialist.
Hmm.
When I went to the breast specialist, he immediately told me, "I think you and your gynecologist are overreacting."
Oh boy.
And I felt a way about that because
Yeah.
it was very belittling.
Huh.
And all I could do was say, can you just do the biopsy anyway? I think that's what I was sent there for, a biopsy.
Hmm.
Can you just do it and and tell me what you see? And you know how do you suggest that we advocate for ourselves in situations where a doctor may, let me just be blunt about it, may just be an asshole?
Yeah. So right before you said that, I was going to say, good for you for advocating for yourself and saying, you know what? Okay, fine. You may think this is unnecessary at the moment, but this is what I came here for, and this is what we're going to do. So good for you for doing that. And we all should be that forward when it comes to advocating for ourselves and what we think is the best thing to do for our own personal care. So that's number one,
Mhm,
is do what you did, advocate. If you
Mhm.
feel like you're hitting your head up against the wall when it comes, and this is for any relationship with any medical provider, healthcare provider, find another one. There are plenty of folks out
Mm.
there that you can choose from. If you have limited access, if you're in a rural area or you're in a healthcare desert where there aren't many options, you may have to go to the nearest city that has more resources that you
Mm.
can use. But if you feel like something needs to be done for your own personal health, keep asking and
Mhm.
keep talking until you get what you feel you need.
Okay. And so what happened with me in that case, this was December of 2019, he did do the biopsy
Hmm.
um, slash aspiration. And so it turned out that I just had cysts.
Hmm.
Um, but what he didn't know that he discovered during that process was that I had so many cysts, he couldn't count them all.
Oh, wow.
He aspirated he aspirated the two that he could, you know, that he could see,
Hmm.
that he could get to. But all the other ones, they were so small that he just couldn't even, he couldn't even count them all. He stopped counting after 12.
Yeah.
Um, and he told me that, I'm just cystic,
Hmm.
I'm just one of those people that just develop cysts. Um, so that was, I mean, that was good news. I was happy to hear that they were benign. They were
Yeah.
completely benign. I left that part out. Um, but what can you tell us about, just cysts, just whatever these benign cysts are? What are they composed of? Why do some
Yeah.
people get them? What's that about?
Yeah, so some women have fibrocystic breasts, just like you can develop lots of cysts in the ovaries. The same thing can
Mm.
happen hormonally with the breast. And you're right, generally they are benign, but you know, to be on the safe side, usually what I would advise patients, particularly in your case where they had a double family history, on both sides of breast issues, is more frequent screening. So we may not necessarily be doing mammograms every 6 to 12 months, but we certainly are making sure that you're following up with your own self exams often. And we may hook you up with a breast specialist even sooner than we would for someone doing normal screening. Um, so even though they are benign, it does and can potentially put you at risk to have other breast issues. And if you have a positive
Hmm.
family history, you'll want to talk about how frequently you should be screened, how frequently you should get ultrasounds, how
Okay.
concerned you should be if those cysts begin to change. You definitely want, or
Mm.
the avoidance of hormones, so talking about birth control with some of these ladies is very important because you don't want negative things to happen and things to be stimulated, growth and development to be stimulated by hormones
Oh,
unnecessarily.
okay. That's so
Hmm.
good. Thank you for that. So I'm going to move on to my surgery. My surgery was on July 31st, and I went in for my surgery early in the morning. Um, and up until that day, anybody who knows me knows I run every day. I do a morning run, usually 5K. Anybody who's watched my little stories, you see me say, "Hey, I just finished my 5K. Are you proud of me?" I'm proud of me. Y'all know the deal. So I did my morning runs. I think I was on day 341 on the day of my surgery when I ran that morning before I went to the hospital.
Hmm.
All that to say, I was in really good physical health. So when I had my surgery, the doctors were both pretty confident that my recovery would be pretty good, pretty relatively easy. I was hospitalized for 3 days, I believe. The surgery went off without a hitch. On the second day in the hospital, I think the goal was to get me out of the bed, to be able to stand up. So I was able to do that, stand up. Then I think on the next day, I think the second day I stood up and walked around a little bit.
Hmm.
Now I had the IV bag and stuff
Yeah.
connected to me. I had two drains connected to me.
Hmm.
So I couldn't do a lot of walking around, but I could at least get up and do what the physical therapist had me do, which was
Yeah.
step on a step, and step back down.
Hmm.
Um, by the third day, or yeah, the second day after my surgery, I was walking around. I think they
Good.
removed the IV from me. Um, so maybe I was in the hospital 4 days. I can't remember. It's all a blur. But there
Mhm.
was a lot of pain medications involved. but they I was able to walk around, and I was walking around the whole wing of the hospital floor that I was on, by myself. And so the doctors were really happy about that, because I think the sooner that you are ambulatory, the sooner that your gastrointestinal stuff starts kicking in. And when you can have your first BM, that's when they'll be like, okay, we can let you go.
Yep,
Is
if you can
that
poop,
kind
you can go
of
home. That's right. Yeah.
accurate? So, but beyond all that, just my stay in the hospital was pretty cool. The thing, I say pretty cool. I mean, it was good.
Good.
There is a lot of prodding and poking every few hours because they have to keep a really close watch on that new tissue that they put into your breast.
Yeah.
Um, so so every couple of hours it seemed like somebody was coming by, even in the middle of the night, to
Mhm.
check the tissue and make sure, are they making sure that the vessel is beating? What are they listening for when they put the stethoscope or whatever that listening apparatus is up to your chest?
Yeah, they're listening for blood flow, right? So they wanna make
Okay.
sure that the tissue is oxygenated and the oxygen is being delivered by blood. So you can hear blood flow through your blood vessels, and making sure that it's getting pumped to that tissue so that the tissue doesn't die. So yeah, unfortunately, and being in the hospital is never restful, right? Because like you said, every four
Right.
hours, if not more, if it's not a nurse coming in to poke and prod and stick, if it's a
Yeah.
phlebotomist or it's the doctor putting
Yeah.
his or her cold stethoscope on your chest. But you know, the fact that you were so healthy going in, right? So the healthier you are, well, in general, but then definitely prior to a surgery, a cancer treatment, etc., the quicker you can go home and get back to your routine. So kudos to you for keeping up with your health and staying healthy and being active and not smoking and not doing all the things that we know that get in the way of healing, tissue recovery and healing to help you to heal as fast as you did.
Thank you. I didn't know at the time, over those 341 days prior to, the surgery, what I was preparing myself for. I
Mhm.
think it was just divine
Yeah,
intervention that the Most High saw fit to help me get into a new physical fitness regimen
right.
that probably started, to be honest with you, in 2020,
Mm,
during the pandemic, when
mhm,
I was physically and literally grounded, and couldn't go anywhere. So I had to find something to do,
right.
and the thing that I stumbled upon was running. Um,
Yeah.
I'm gonna pause here and take some questions,
Okay.
if we have any questions. I meant to take questions before, but I'm gonna see if anybody. I'm gonna try to scroll back through and see if we have any questions, or if you have any questions, put them in the chat, and I'll see them,
Mhm.
whether you're on YouTube or on Facebook. I see somebody on YouTube says, I work in radiology. This is Royal Singleton. I work in radiology. When patients come for breast examinations, I always tell them to get a copy of their report and images. This way, their OBGYN and primary care physicians have all the results. That's really good.
That's
Thank
key.
you for that. You should
Mhm.
always, yeah, keep a copy of your results, or get a copy, because I remember before my network was the UCLA Healthcare Network. My radiology was through, an outside source, and it was
Mm,
always a hassle trying to get a damn CD of
right,
of my results.
right,
Like
and
it
we
was
don't do anything with those
1999.
CDs. We Not all of us can read the images. Like, we need the report, we need the words. Give me the words.
Yeah,
Yeah.
yeah, yeah. So that's good to know.
Yeah.
Let's see. We have, who else do we have? Um, Timothy says, watching and listening to this is bringing back memories of my late grandmother and her final years before succumbing to the effects of breast cancer in mid 2018. I'm so sorry for your loss, Timothy. Yeah,
Mm,
this hit close to home for a lot of us. I think when I made my announcement that I had breast cancer, I can't tell you how many people chimed in on all my socials with positive words of encouragement, but also with personal stories of their own journeys.
Right.
And it was so helpful to hear from all of you, whether you were lifting me up in prayer or vibrations, or whether you were sharing your own stories. So many of you offered me advice, things that I wouldn't have known. I'm not a big WebMD girl. Like, I don't like to go on those sites and try to self-medicate.
Good.
So it was really helpful. The doctor said good.
Good.
So
Even
it
though
was
even though
really
I
helpful.
do edit for WebMD, but
Do
no, it's
you?
all I do. But it's always best to talk to your personal person, your healthcare provider face to face. Get a little bit of info from WebMD, but then take it to your doctor. Yeah.
Yeah. Um, but yeah, I got some great advice,
Mhm.
just especially on things like I wouldn't have thought about, like the type of bra to get after to wear after my surgeries, the type of nightgown I might need, that kind of thing.
Yeah.
I'm going to go to this question from Sharon Burton. She says, I noticed that a few peers at menopause seem to develop breast cancer. Is there a relationship with hormonal changes and breast cancer?
Ooh, that's a good one. Hey, Miss Sharon, I know you. Hey. That's a good question. So menopause starts at different ages for different people, right? But average, usually late 40s to your, early 50s is when quote the change starts to happen. I can't say specifically, and there could be, I just don't want to misquote literature, but I don't know specifically about, the decrease of estrogen making it easier to have or develop a breast cancer. But I would think that the timing, right? So if we're all pretty much starting in our 40s, maybe even having waited until you're 50, given the old guidelines to get your first mammograms and to get them regularly, and then menopause hitting, the timing might be similar. So that you just happen to notice that your friends in that age group are being diagnosed. So could there just be a
Right.
timing situation that happens, or is there some hormonal, maybe if your progesterone, if I talk it through, if your estrogen is dropping, your progesterone is increasing, could that then increase the potential for certain cancers to grow? Maybe, maybe. But um, I would have to make sure I would look in the literature and make sure that that's correct. But I think the timing of when we start getting our regular mammograms and when you would pick up on it and when menopause is happening are around the same time.
So there might be a correlation, but not necessarily causation.
Potentially. I don't know the literature. I don't want to misquote the literature.
Right.
From off the top
Right.
of my head, I'm not sure if I can think, because again, if we were talking about the time when your estrogen was increasing, I might be a little bit
Mhm.
more convinced that that would be related to increased risk of breast cancer. But during menopause, your estrogen is actually decreasing. So I would have to look that up. But potentially the timing has
Oh, okay.
something to do with it. Yeah.
Oh, okay. I also have a question from, and this is sort of a good question from Lou Paris. Uh, he says, or she says, he says, after the mastectomy, do you have the same sensations? This is an important question, even though it's a little personal. I don't mind sharing. That's what we're
Yeah.
here for tonight.
Yeah.
My breast surgery, in particular, my surgeons were able to save the nipple. Okay, so they were able to reconstruct the breast with the nipple. So
That's good.
aesthetically, my breast looks the same as the right one. Okay. The symmetry is very, very
Yeah.
close. The sensations, however, are markedly different. Um, I won't say that it's numb. I'll just say what I feel on the left side is more of the sensation of pressure if something is against it, rather than the sensation of like touch, if
Gotcha.
that makes sense.
Yeah.
Um, and that actually goes for much of my abdomen now because of the flap that I had. I was cut from here to here,
Mm,
for that surgery. And so all of this is like new. I had to have a new navel constructed. My tattoo that was on my stomach, my little Sankofa bird, is now just
mhm,
a head of the Sankofa
mm,
bird. So all of that feels different. It feels Like if somebody tried to tickle me, I probably wouldn't laugh. That's how
Right,
it feels.
right.
But that's a really good
If
question. I'm glad you asked.
Yeah, and I would think with any surgery, particularly if you're cutting through what we call adipose or the fat lining that lies on top of muscle. So I didn't have any adipose tissue on top of her muscle. She has, six pack, eight pack. But anytime you're cutting through layers, skin, adipose tissue, muscle, blood, all that stuff, you're cutting through nerve, right? So you have little
Mhm,
nerves that kind of bind together and give you sensation. You're cutting through those. And so some of those things die off and have to regrow, or some of those things die off and never regrow. And so you're taking nerve related tissue from one part of your body and putting it in another part of the body. Some of those nerves have to reconnect, they have to rebranch, they have to, be gather together in a new environment. So potentially with time, you may, depending on what your surgeons told you, you may um, gain some of that sensation back. In some areas, you may not necessarily feel the same,
mhm.
just because the environment is different. Those nerve endings are different, right?
Yeah.
Yeah,
So the nerves have to regrow. I didn't know that nerves could regrow.
they do.
That's
Everything
exciting
grows.
news.
Everything grows like this. Yeah,
Wow. So
yeah.
nerves can regenerate and regrow.
Hmm. Hmm.
Thank you. So I have a question on YouTube from John McCann. He says, I came across a reputable show that had an expert suggesting mammograms are overdone, particularly for those with no familial risk. What's the balance?
Yeah. So that's a great question, John. So that's why a lot of the guidelines and the standards have changed. We used to say once you start getting mammograms, do them every single year. And then most recently, they decided that every other year, as long as your risk is low, is good enough. The worry about overdoing any type of screening or radiology study is finding what we call incidental findings, which are findings that you weren't looking for, that you find that now you have to worry about, which you wouldn't have been worried about in the first place. Does that make sense? Right? And then we
Mhm.
start doing all these things to these incidental findings that then have complications, and it snowballs. So
Yeah.
there is this balance that we have to strike between not ordering too many studies when they're unnecessary and ordering them so we can find out what's really going on. So personally, even though the standards say do every other year, I still, because again, I am a Black woman, I do them every year because I know that we are at increased risk. You can make that personal decision for yourself to have the studies
Mhm.
as often as you feel, as long as it's medically safe, because you don't want too much radiation to your body. Having these studies exposes you to X-ray radiation. That's not good either.
Mhm.
So there are cons to having these studies way too often. And then again, for these incidentalomas, what we call them. So let's say you're doing, you get a chest X-ray. You want a chest X-ray done every month because your family has a history of lung cancer. That's not recommended. But let's say just
Mhm.
say you do it, and you see scar tissue that was there from a
Mhm.
cold you had when you were 6 years old. You see it, but now
Yeah.
you have to do something about it. You're obligated to see it, follow it, do something about it. It's something that you wouldn't have normally been worried about, but now that you see it and know it's there, stress happens, biopsies happen, unnecessary things happen. So always
Mhm.
have the conversation with your physician, and your provider, do what's comfortable, and
Yeah.
will help make you feel like you're doing what you're supposed to do, but don't do unnecessary things to your body.
Let me ask you this. John McCann followed up with, what about advice for men for mammograms and self-examination?
Yes, good question. So during every physical exam, every man should also be getting some sort of chest, palpitation or chest exam, particularly if you know that you have immediate family history, or you definitely, if you had a male relative that had breast cancer in your family. You want to talk to your physician about that, and you want to tell them about that, because then they'll pay special attention to those areas. And then you can also do your self exams. For men that don't necessarily have a family history of breast cancer, I wouldn't necessarily say do quote self exams. Like I would encourage men to do like testicular exams, for instance. But if you do know that you have a family history, or if you ever feel something that you're worried about in the chest or pectoral muscle area, please go and have that evaluated.
That's so good. I'm so glad you brought all of that up. Thank you for
Yeah.
those questions, everybody.
Mhm.
John McCann, Lou,
Yeah.
uh, Ellen, thank you for your comments there in the chat. Sharon, thank you so much. Royal, thank you. I wanted to also mention that now that I am post surgery, post recovery, post all of that stuff, I have a new screening schedule.
Mhm.
Because now that I have had breast cancer, which actually turned out to be stage 1A, not stage 0. They found more cancer in my breast tissue after they removed it.
Yeah.
So I'm so glad I got the mastectomy because the breast cancer that they found was outside of the duct.
Right.
So I may have potentially, had that microinvasive cancer in me and not had it removed had I only had the lumpectomy. They weren't able
Right.
to see it because my breast tissue was so dense. Um, I am definitely part of the itty bitty titty committee. I'm the president. So,
All are significant.
so,
All are important.
but that being said, I have a new schedule now. My schedule is one mammogram a year and one MRI a year. My
Mhm.
mammogram is in April. My MRI is in October. So that's my new schedule from here on out. As we were just talking about, schedules for mammograms and screenings. This
Mhm.
also differs from country to country. I was talking to a friend, my bandmate, who is from Russia, and she said her doctors they wouldn't even schedule her for a mammogram. They were like, "You're just too young." And I think she just turned 30. Like they wouldn't let her get one at all, you know.
Mhm.
Um, but I may have started getting mammograms really early because of my familial history, with breast cancer. So again, I think you just got to ask, make sure you know your family history and tell your doctor everything you know so that they
Mhm.
can, give you the right referrals and you can get what you need to get.
Right.
Um, let me see. I thought I saw something that I wanted to read. Royal Singleton says our patients 43 and up primarily have an ultrasound and mammogram every year. So,
Hmm.
as a rule of thumb, this is from a radiologist.
You
Um,
mean once they're
so,
diagnosed, Royal, if you're able to comment, once they're diagnosed with cancer or just
Royal, yeah,
routine patients?
yeah, Royal, follow that up and let us
Yeah.
know if that's from patients who are already diagnosed. So,
Mhm.
as we move on, I wanted to take us into resources.
Mhm.
Um, Women's healthcare is not always as easy to access for everyone. Especially right now in America, our healthcare is kind of under attack. Um, with a lot of clinics being closed, it's a somber time for us. I'm not gonna lie, it's scary. I'm glad I
Yeah.
live in California. But without getting political, let's just talk about some of the resources that people can go to for screenings. We have the National Breast Cancer Foundation. They have a great exhaustive list of places where you can get screened for breast cancer. So does the Susan G. Komen Foundation. They have a really wonderful list. The American Cancer Society. What I have found is that therapy from a therapist who is trained in cancer patient treatment is really
Yeah.
important. So the American Cancer Society and the Association of Black Psychologists, ABPSI, they have a directory of psychologists and therapists who are trained with working with patients who have been diagnosed with cancer. So it's not really just about your physical health at this point. It is also about your mental health, your emotional health, and wellness all the way around. And speaking of wellness all the way around, I had some dietary changes that I was required to make, Doc Swiner, and I wasn't.
Mhm. You weren't happy about
It
it?
was hard.
Yeah.
I wasn't that happy about it. It was. Let me say this: I am. a vegetarian. I'm a pescatarian. I eat fish
Mhm.
every now and then. I don't eat
Mhm.
shellfish. I don't eat crabs. I don't eat shrimp. I eat fish every now and then, not a lot. I am mostly plant based.
Mhm.
Mostly. I still do dairy. I love me some ice cream. I only take cream in my coffee. I like cheese. My nickname is Mouse. Okay. So when they told me after my surgery that I had to consume 80 grams of protein a day, I was like, 80 grams where? How am I
Right.
have y'all seen how I eat? Like, um, I weigh about 135 pounds. I barely, eat 2 meals a day.
Yeah.
So this required some really intentional, consumption from me, and I had to go all out and find protein that I liked, protein sources that I liked. There's a lot of yogurt and Chobani drinks
Mhm.
that had extra protein in them. A lot of there was another one that's plant based. I can't remember. Anyway, tell me about that. Why so much protein? Why do we have to change our diets? What's important that we eliminate or put into our diets from a medical perspective, and why?
Yes, they want you to be healthy and chunky. No, I'm just kidding. No, they want you to have they want some meat, literal meat on your bones.
Hmm.
The more cushion you have, the more protein you have, the more muscle can grow, the more tissue can grow, and it helps you to
Mm,
recover faster. If you're skin and
mm,
bones and you fall down and crack a bone, that's not very helpful, right? During the time of your recovery, they want you to have some cushion, and they want your kidneys to have protein ready to process. They want your muscles to be ready to create oxygen with your blood flow. So the more protein actually is better for most cases, for most surgeries, no matter what the condition is. So kudos to you for squeezing it in. Did you do some protein
mm.
shakes too?
I've only done maybe a little bit. I don't really like the protein shakes, but my husband always drinks protein shakes, and
Mm,
he uses a company called, I think it's Just Move Supplements. Is that
okay.
one? Is that the one? And they have some great supplements. If somebody can put that in the chat, if you know what I'm talking about, I think it's called Just Move Supplements. They have flavors like sweet potato pie. Um,
Ooh.
so I know that he's really fond of that one. Yeah, it's it's black owned. It's a black owned company, so they
Oh,
got some good
nice.
flavors. Yeah, um,
Let me ask you
but
this, I'm sorry to interrupt you. Did they
no,
hook you up with a nutritionist through your
yes, so
oncology office? Oh, good.
yes, she came to see me in the hospital during my recovery.
Oh, good.
I don't know if that was a great idea because I don't know if I
Oh,
retained
not
all the
good.
information she was telling me. She was very sweet, and I remember her telling me some things,
And
but
you're just like,
I was I was so loaded up on pain medications, and
yeah,
I was literally getting pumped with medication every 2 or 3 hours, for one reason or another, whether it was
that makes
pain
sense. Yeah.
medication, whether it was a diuretic, whether it was, um, so, but I do remember the 80 grams a day thing. But after my surgery, maybe a few weeks post-op, I met with a new dedicated oncologist for me, for my case, and she gave me a list of sort of do's and don'ts. I should have had the list in front of me to talk about, but I do remember some things. I had to add a calcium supplement to my diet. I had to add a vitamin D3 supplement to my diet.
Mhm.
Um, I needed to add, I was able to maintain, go back to taking the things I was taking, which are wellness formula and fish oil. Um,
Mhm.
but I had to add something else. What is it? Other than the protein. Oh gosh, there was something else. I can't remember off the top of my head. But
Okay.
what was, oh, I already don't drink. I already don't smoke. So my sugar intake is not as high as like people that might drink, right?
Mhm.
Because although I do like sweet things, I don't like I don't go crazy with them.
Yeah.
And smoking is self-explanatory. Yeah, we all know smoking
Don't smoke.
causes. Don't smoke. Okay.
Don't smoke.
Um,
Period.
don't smoke. Period.
Period.
Just
Yeah.
don't do it. Um, so I was already there. I didn't have to stop doing that. Uh, but yeah, I do have to just be really conscious of the protein thing. Oh, one other thing I had to do, which was really hard. The day of my surgery was, or the night before my surgery was the last day I could drink coffee until,
Uh,
I don't know, it was like a month. It was like a month until I could have caffeine again, coffee and chocolate.
oh,
And anybody who knows
that's
me knows
brutal.
how much
That's
I,
brutal.
what? It was crazy. It was
Yeah.
crazy. So I think it wasn't until I got my drains removed and the suture that was covering my abdomen removed, that the doctor told me I could go back to coffee, but only decaffeinated for like
Uh,
2 weeks, and then after that I could go back to regular coffee. But the decaffeinated coffee was totally fine. I was just as happy with the taste of coffee, the idea of coffee. But
good.
what about
Yeah,
what is
I
that about
remember.
caffeine?
Yeah, I'm vaguely remembering now. Ladies, particularly with like fibrocystic disease, or if you have cysts
Hmm.
that grow in the breast, they will tell you to decrease your caffeine. For some reason, there's potential stimulation. So
Mm-hmm.
yeah, that would be a hard one for me to do.
Okay, yeah. I remember another doctor friend of mine telling me that there might be some links between sugar and cancer.
Hmm.
Have you heard
Yeah.
anything about that?
It not particularly, but it makes sense. I mean, sugar is, we need it to live, but we eat it in excess, and almost
Mhm.
anything in excess is a bad thing. Like nothing is great outside of moderation. So I can imagine that sugar would help encourage the growth of all the bad things in our
That's what she
bodies. And
said.
so,
Yeah, yeah. So,
especially the unnatural versions of sugar that we often eat, and especially the American diet.
corn syrup, high fructose, blah blah blah, that kind of thing,
Yep.
right?
Yep.
Yeah. What about uh aluminum and what we have in like
Hmm.
deodorant, for instance? I've heard that it's better to use a natural deodorant. I am reticent
Yeah.
to do that.
Yeah. So again, I can't quote the studies off the top of my head. I have heard
Mhm.
that theory. Unless again, because I'm a physician, unless I've read a study of a research study or read a paper on a research study that has been done for many years on many, many patients and has the right statistical analysis. I take some things with a grain of salt. I can't ever recall telling a patient to avoid, the brand name deodorants that we're most familiar with. I won't state any brand names on the internet, but I've never necessarily told someone to avoid that for health issues. It's usually been a personal decision for my patients whether they avoid those or not and want to go the natural route. Um, but I will say for when it comes to my, kids, we try to get the
Mhm.
most natural, organic version of deodorant available versus using the high scent, a lot of perfumed, colored, scented
Mhm.
type
Mhm.
chemicals that they put in some of the brands. So you use the most basic, natural baking soda related one as possible, just to avoid any problems. But that would be something else that you would want to do your research on and make sure the research study is an accurate and an appropriate one before you make that call.
Yeah. Um, Thank you for that. Also,
Mhm.
alkaline water is something I hear about people. You know, drink more alkaline water. Drink more alkaline water. I guess it can't be bad for you, right?
It can't be bad. I don't know if I would put a whole lot of weight into how much better theoretically it is. I
Hmm.
have read some studies on alkaline versus normal water, and my only concern about that is, of course, overdoing it. We do need some of
Okay.
the acids, that
Hmm.
come in water and some of those natural occurring things. We do need some of those things for what we call
Yeah.
acid-base balance in the body. And if you're avoiding
Yep.
all the acid, acid is needed to digest and to kill bad bacteria and all that. So if you're missing it, that actually can have some negative effects too. So you know,
Okay.
again, that's a personal
Um,
decision. I don't know if it's research based necessarily.
okay. Anne Love has a question on Facebook. She said, I had a biopsy and they hit a nerve. Now I have pain and sensitivity. The doctor
Ooh,
stated it's scar tissue healing. Could that be true? I've seen two doctors and they gave me the same response. Are there some other options? And this is from a biopsy.
so they told you it was scar tissue that was healing. Could that be the pain? Potentially, or it could be the actual, what, remember we mentioned the nerves growing back that
Hmm.
can particularly, could cause some neuropathic pain. So that's one
Hmm.
potential answer. Are there options? Did they prescribe any numbing cream? Lidocaine comes in topical gels that are both over the counter and you can get prescriptions for. They can do, more poking and prodding, but they can also do injections that hopefully will help some of that scar tissue not be so
Yeah.
sensitive. So you just have to talk to your surgeon and see what their options are. What has worked for other patients.
I feel like also, just a gentle massage of all your body parts helps things
Hmm.
regenerate, helps get your
Yes,
oxygen moving around, helps those
yes,
nerves, recalibrate, like, oh,
yes,
there's action there. So,
yes.
don't be afraid to massage yourself there, just
Or have
wherever
massage
you.
therapy. Yeah, absolutely.
Hmm. Yeah.
Oh, they're pain
Uh,
patches too.
Pain patches. Okay.
Hmm.
That's good. Um, all right. I think we're going to wrap this thing up. We are at the end of Breast Cancer Awareness Month. I am coming up on exactly 90 days since my surgeries and feeling really good. If you guys have followed my journey, um, it was relatively easy.
Yeah.
I know that other people have experienced breast cancer and gone through much more difficult journeys with different treatments, with double mastectomies, with
Hmm.
radiation, with chemo. Um, my heart and love goes out to all of you.
Yeah.
Some of you say call yourself survivors, some of you don't define yourself by breast cancer at all, some of you don't use the C word. I get all of that. We each have our own way of identifying ourselves and marking our journeys, but
Hmm.
no matter what, I appreciate you. I thank you all for being here with me, for keeping me lifted, for keeping each other lifted in this, and thanks to all of our supporters and caretakers around us. I couldn't have gotten through this without my husband. Um, and Doc, I want to thank you and all of my doctor friends who gave me advice for the free. I really
Out of love.
appreciate I really appreciate your time and your expertise and your consultation with regards to this issue. We
Excuse me.
are in a precarious time right now. Information is available from all over the place. Like we
Yeah.
don't have to run to an encyclopedia to look up something. And for that reason, I think it's really important that we are vigilant about the sources that we get our information from. That's why it was important for me to have a medical doctor on this broadcast with me today.
Mhm.
Um, I know that we have seen other figures have journeys with breast cancer and make decisions based on misinformation. And I want to make sure that we don't do that, that any of you don't do that. So always consult. And there's nothing wrong with holistic practice, but holistic means the
Absolutely.
whole thing. Okay, so make
Mm,
sure that along with your natural practitioner, you also call your medical doctor
correct.
and put it all together
It's a
for your scooby
team
snacks.
effort. Team
It's
effort.
a team effort. It's a team effort. It's a team effort. But whatever you do, don't sit at home and not get treated. If you think you have something, go into the doctor's office, advocate for yourself, get your regular screenings. And if you haven't had your screening for 2024, go ahead and put it on the schedule now so that you can get it done before the end of the year. And
Right.
that's all I got. Do you have any final words?
No, ma'am, I hope that we'll post this, the recording, so people can come back and look at it. You can share it with your friends, share it with your family members, particularly those who are going through their own breast cancer journey. And if you have any questions or concerns, feel free to reach out to me. I'm on IG at Real Doc Swiner, so Doc DOC, my last name, Real Doc Swiner on IG, and also on Facebook, Doc Swiner, my business page. Feel free to send me a DM or a comment, and have that conversation with your own personal provider and primary care physician.
I want you to say your Instagram again.
Yes. Real,
Mhm.
REAL, Doc, DOC, last name Swiner, SWINER, on
All right, I'm
Instagram.
putting that in the chat on Facebook. On
Yeah.
YouTube, I can put that in the chat too. My
Hmm.
brother just chimed in. He said, I'm proud of you, sis. Thank you, Sydney. I love you so much. My family has been really supportive through all of this. I think if it's possible, we're going to leave this up for people to catch the replay.
Oh,
Um,
good.
and at least on Facebook, I know we can do this, right? And maybe on YouTube also. I want to
Hmm.
thank our behind the scenes producer of this. This is Doc Swiner's husband and my fellow Bison brother, Rick Swiner. Thank you so much for producing this whole thing and making sure we came off without a hitch. Um, that's all, you guys. We're going to
That's
sign
it.
off now. Thank you for joining
And go
us.
vote.
Be
Go
well.
vote.
Peace.